Hello, everyone. Good morning, good afternoon, good evening, wherever you are in the world today. We are very excited about today's presentation on adopting a sustainability mindset. I'm Mary Bullock. I'm a board member of the International Council of Psychologists. Our speakers today are Dr. Reed Omary from Vanderbilt University and Dr. Andy Simon from Seton Hall University, and our moderator is ICP President Polly Hagenars. For those of you who don't know, the International Council of Psychologists, the host for today's webinar, is an organization of mostly psychologists with a focus on exploring psychology, human rights, dignity, and justice. Membership in ICP is open to all. In addition to publishing a newsletter with news items and brief articles, to hosting a number of discussion groups where members can explore topics on health, climate, social issues, and the like, ICP hosts webinars like this one and sponsors the Global Network of Psychologists for Human Rights. In addition, our annual conference this year will be in Rotterdam, the Netherlands. Registration is open and we welcome you all to taking a look at it. You can find out more on the ICP website, which is listed on the screen. So before we begin today's webinar, there are just a couple of housekeeping comments. First, please ask questions in the QA function or in the chat. And I see you're already saying good morning and introducing yourselves in the chat. That's terrific. We will try to get to all of your questions during the discussion. And secondly, a recording of today's webinar will be posted on the website in a few days. And last, we will automatically send a certificate of attendance to all of you who are with us for at least 40 minutes. And now I would like to turn over the meeting to Polly Hagenars, who will introduce our speakers.
Thank you, Mary. And again, a very welcome to our speakers today. First, Dr. Reed Omary. He's a professor of radiology and biomedical engineering in Nashville, the USA. And as a physician scientist and an educator, his work focuses on healthcare innovation, strategy, and sustainability. And Reed served as Vanderbilt's chair of radiology from 2012 to 2013, oh, 23, I'm sorry. And Reed chaired the Vanderbilt Medical Group, founded Vanderbilt Medical Innovators Development Program, and co-led Vanderbilt's medical strategy. He also served as president of the Association of University Radiologists. Most recently, he founded a non-profit called Greenwell Project, cut waste, increase efficiency, and make patients happier, all by asking the right questions. Reed helps healthcare organizations across the world use sustainability to improve their operations. And the second speaker today will be Dr. Andrew Simon. And Ando is a professor of psychology and the Leadership and Professional Development Fellow at Seton Hall University in New Jersey. And as a social and organizational psychologist, his work focuses on leadership, systems dynamics, and fostering organizational effectiveness. And he has held senior roles in executive education programs at the Wharton School of Business and University of Pennsylvania's nonprofit leadership program. His international experience includes guiding strategic initiatives for Uganda's largest child-focused NGO, and he recently served as the 2023 president of the International Council of Psychologists. Andy is a trusted advisor who consults with organizations to develop leadership strategies, empower team performance, and enhance organizational impact. I give the floor now to you, Reed, for your presentation.
Thank you. Thank you all. Can you see my slide? So I'm Dr. Reed Omery, and it's such an honor to be with all of you today. And this is an incredible moment of global transition. So the discussion we're going to be having today, I think, is highly relevant to all of our lives and to everyone that we serve. So today I'm really delighted to be together with Dr. Andy Simon, and we're going to talk about how to lead change with a sustainability mindset. And as we begin today, I do want to just recognize the devastation and suffering that is been occurring due to the wildfires in Los Angeles. Because of that, I would like to dedicate our program today to the residents of Los Angeles and use their resiliency as an inspiration for all of us for how we can embed a sustainability mindset into all of our actions. I would like to start with a story. This is a picture of me. A little over a year ago in Polly's hometown in Amsterdam. And I had stepped down as chair of radiology at a large medical center in the American South to focus myself and pivot my career into better understanding climate change and sustainability. And I have a science background, and I consider the most important way to learn is to actually get out into the field and perform discovery. And while that can occur in a laboratory or it can occur with clinical studies, if you're a physician, it can equally occur by going out and trying to speak and interview as many people as possible. And so over a 1 year time period, I spent a lot of time traveling the world and meeting with everyone from poets to politicians, from CEOs to chefs, and from students to scientists to understand what their needs were and how they viewed climate change. Uh, I would like to share with you some of the lessons that I learned from this as a way for us to consider how we might embed a sustainability mindset into our lives. And uh, one thing is very clear, and according to the World Health Organization, climate change is the single biggest health threat facing humanity. And we see the effects of climate change for what happened in Los Angeles, but we also see flooding elsewhere. We see significant air pollution, which actually has sparked asthma in my own daughter. We also see it in terms of individuals having to migrate from their lands because of either drought or flooding. So it is incumbent on us, anyone who cares about the health of humans and the health of communities, to also care about the health of the planet. Right now, as we speak, in Davos, some of the wealthiest people in the world are convening. And as they're sipping their cappuccinos and they're drinking their wine, they are also discussing what are the greatest risks that will affect their businesses. And we can see in this latest report that just came out last week that for the next 2 years, it's mis and disinformation, often related to climate change, and then actually the direct events of extreme weather. But when we look for the next decade, these are some of the wealthiest people in the world. The top 4 risks all relate to the health of the planet. So while many of us here are today because we care about justice and we care about equity and we care about elevating the lives of those who are at risk, there's also a clear business rationale for why we have to care about this. And I think that's important when we think about a mindset for sustainability, especially given some of the political headwinds which we face. During my sabbatical, as I interviewed hundreds of people, it became clear to me that no one was aware what patients thought about climate change and what patients thought about how their care might be improved by reducing pollution, by reducing waste. And if we look in the United States, 8.5% of all the greenhouse gas emissions come from healthcare. And said differently, if healthcare were a country, it would be number 5 in terms of emissions globally. So as I was investigating what patients thought, I determined the best way was to ask them. And I sent out a survey to about 1,400 patients. This is in the American South, so this is not a liberal bastion. This is a bastion actually of often mis and disinformation related to climate, related to justice. And one aspect of sending out a survey was that I tried to remove the ideologically charged terms. In the United States, climate change is the single most partisan issue. You can predict with 93% confidence what political party someone is in based on what they think about climate change. And so I was intentional in sending out this survey to avoid that triggering term and instead focused on terms like health, like pollution, and like waste. And I think that's an important lesson because even in the American South, when we shift the conversation to terms that everyone cares about, suddenly this pushback that happens towards climate action dissolves. And we see here when we ask patients that actually over 90% understand the tremendous impact on their own health, on the health of children, on the health of the sick from excessive pollution, from excessive environmental degradation. And we asked the question, if we had 2 physicians who were equally good and one worked to reduce the amount of pollution compared to the other, which physician would you seek? And we found that 3 out of 5 patients would prefer a physician who cared about reducing waste and pollution. So we now see patients care. And with that in mind, I was very fortunate to meet Liz Schumacher. Liz Schumacher is a 4-time kidney transplant recipient. This is Liz just 4 or 5 hours after receiving her last kidney transplant. She is a patient entrepreneur and she oversees in a company which helps administer the operations of over 25 medical societies. And after meeting Liz, we really hit it off in terms of understanding that patients care about their own health and they care about the health of the planet. And what's really interesting when we think about sustainability, there's the concept of stewardship. How do we take care of something that's precious and that has a limit, that's a limited resource? And when we look at medicine, the most precious and stewarding aspect of medicine is actually transplantation. If you think about it, because we take organs from individuals who have unfortunately had to pass away, and we pass them along to help others survive. We can take that same approach to everything that we do in medicine to better the health of our patients and our communities and our planet. So Liz and I co-founded Greenwell Project. This is a nonprofit. I'll give you a link afterwards. It's greenwellproject.org. And our purpose was to co-design sustainable medicine together with patients. Instead of viewing patients as the individuals who will listen to us, we flip it. We flip the script and we say, we in healthcare will be so much better off if we listen to patients. Patients know and identify and experience all the terrible waste that is in healthcare. How long we have to wait for appointments, we have to wait in line, how much waste comes in forms of plastic, in packaging, in gloves, in gowns, and how much that waste actually starts impacting the health of others around them. So Liz and I formed Greenwell Project as an opportunity to try and address this very need to help health systems identify how they can improve quality, how they can save money, how they can reduce pollution, or to help medical device manufacturers design more sustainable products. So we're very excited to launch this, and we're interested in working together with anyone across the world so that we can co-create sustainable medical practices together. And what I will leave you with is this direct ask, and that is for all of us who care about medicine, who care about healthcare, who care about our kids and our families, for us to consider the planet as a patient. Fundamentally, the planet is our biggest patient at all, and we can do this together. And I want to thank all of you. I have a QR code here to Greenwell Project, and I look forward to the opportunity of partnering, hopefully, with many of you. Thank you, and I now am really honored to pass the baton off to Dr. Andy Simon, who will talk about sustainability mindset.
Thank you very much for that, Reed. I want to tell everybody that the way I was affected during my first conversation with Reed about his work and everything that he was doing was something that emerged during our discussion was the amount of resistance and pushback that he was getting from his professional colleagues. And if I remember correctly, one even said it was kind of like exhausting to hear this kind of optimism, etc. And it triggered for us a conversation about the salience of the mindset role in trying to bring about the change that Reed is leading here. We know, for instance, that it's not purely a matter of having enough resources, having enough knowledge, having enough expertise. It's not even an issue of getting the news out, because the news is out. Okay, but there is something else that's breaking down here, and that's how we started having a conversation about how do you affect mindset? What's going on with the basic assumption? As Reed mentioned, we know the whole topic has become politically charged. Okay, you can't even mention the topic anymore without people, at least in the United States, falling along the two sides of the political spectrum right now. So it's embedded in all of these pieces, and I just want to spend a couple of minutes discussing one way that we can think about this. And we're in talking about a sustainability mindset. In no way are we saying we have created this idea. We're more like shining a light on the fact that while we think about finances, and while we think about leadership, and while we think about all of the factors that are absolutely necessary to create the future we want, this is another piece that we need to pay attention to. Okay, we can't ignore this as if, well, we just need to convince everybody. No, that's actually a big deal. Okay, and one of the things that came up for me is an organization that I've been interested in for many years. In the late 70s, a nonprofit was started, and I suppose many you've heard of it, called the Hunger Project. And the Hunger Project came forth because the people leading it had looked into why were we doing so badly around solving the issue of hunger internationally. And when they looked, what they found was it wasn't a matter of lack of food. It wasn't a matter of lack of awareness. It was this assumption that the problem was too big for us to do anything about. So there were small efforts which usually involved delivering food. But the recognition was there that we needed something much bigger than that. And so they took on as a mission the idea that what we need to do is shift mindset, get people to have a collective agreement that hunger was something that we can solve and that we need to approach the problem that way. And their focus, now remember, this is the 1970s, their focus was to empower people who weren't necessarily empowered, meaning rural communities, especially women in rural communities, giving them whatever resources they needed in terms of education and authority dynamics, like addressing who had the ability to speak up and convey what was needed, that they were putting their efforts there. And so I thought, boy, that says a lot about what we're challenged with at the moment. That yes, it's true that we need to do something about waste and we need to do, we have to address these things, but there's something also going on about getting caught up in the machinery of the resistance and the pushback. So in looking at like, well, what is a sustainability mindset? It fits with this idea a lot of us have heard about thinking outside the box. And when we're thinking outside the box, I often tell people our first step is, well, what box are we in? I mean, how are we going to get out of it if we don't know what we're in? So, and in reflecting on a lot of the resistance that Reid hears, that I hear most of us on this call hear, you hear this underlying assumption of scarcity, that there's not enough, zero-sum thinking, that if the money or the resources go one place, there's not going to be enough for somewhere else. Short-term thinking, okay? And this idea of, especially among people in healthcare, I'm so overwhelmed by what I'm doing right now. How could I possibly go beyond this? And what we in psychology know about mindsets is when we see the world from a mindset, we tend not to see that mindset. We see from it, we don't see it. And because of the way our biases work, we tend to just gather more and more evidence that we are correct. So spend a day walking around with a healthcare professional and you'll be overwhelmed with all the evidence that this can't possibly work, okay? And the other thing that is uniquely challenging to what we're discussing here, that's different from like what the Hunger Project took on, is that in targeting hunger, you're targeting something that people have a direct experience of. So there's literally not enough food. When we talk about sustainability, sustainability is actually a concept. We don't experience a lack of a sustainable system. What we experience is there's no medicine, or there's no healthcare, or food, or our wells are drying up, or a symptom of sustainability, which we're suggesting can be contributing to the conversation. So you noticed on the survey that Reid created, he put factors that you experience around waste, etc., rather than talking about are you for or against sustainability, okay? Because we don't actually experience that, right? So there's like this additional challenge that we're facing when we talk to people and trying to get them to enact the values and the actions that will make a difference. When we shift this and engage a sustainability mindset, what we're offering is this idea, and I've got it down here. It's like coming from a position of abundance, meaning what's possible, okay? Communicating with people from a position of minimizing fear tactics and talking about possibility. One thing that we know is that when people are presented with frightening future scenarios about which they feel powerless, they discard it. It's overwhelming. So we say something like, well, that person just has to be wrong, or some genius person will just show up and solve our problem. Okay. And so we have to find a way to speak from a position of what's possible as opposed to a scarcity view of the terrible things that are going to happen. It's not to say that that's not part of the discussion, but that can actually backfire at times in our conversations with affecting change. We want to think, how do we see our situations holistically and in the long term, okay, and collaboratively, right? So this is part of engaging the sustainability mindset, and we need to actually be careful of when our own reactive kind of thought processes kick in and we try to muscle somebody into understanding what's important. Most of us have failed. I like to ask these days people in the United States, how often have you spoken intensely with somebody who has a political position different from yours and you changed their mind or they changed yours? I'm waiting for someone, even one person, to say yes. And we need to learn from that. We need to, kind of step into that. Since the Hunger Project, we have more current organizations that, like the Barefoot College in India, okay, which is, again, empowering women to provide health care and to actually fix solar panels in their region. So this is that local focus. We have the Vermont Health and Energy Partnership, where literally the medical center at the University of Vermont partnered with local energy systems to create different ways to power the hospital itself, and then to create and deliver food to patients and staff that reduce the carbon footprint and provided more nutrition. These are local partnerships. Now, returning a bit to the Hunger Project, we all know that we're actually doing quite poorly when it comes internationally to solving the issue of hunger. What have we learned from the Hunger Project is that we need to pay attention to levels within systems. So yes, it's absolutely essential to work and empower people at the local level. We need to utilize the knowledge and wisdom of people on the ground and be open to the idea that what's going to work in one area may not be how it works in another area. And at the same time, bringing this mindset into national, international, global conversation. Without that, we know we're kind of swimming upstream. So the Hunger Project has had a slew of successes, but there's also a recognition that the conversation has to occur at every level. So what can we do about this? What can those of us do about this? Okay, one of the things I was alluding to a moment ago is mindsets don't change because we try to talk people into it. Okay, that is something we've learned like people have given some incredibly inspiring dynamic talks, really motivating speeches where people leave the talk and feel like, right, I'm going to do something about this. And then when you get caught back up in the system of our lives again, we revert back into it. And sometimes the motivational speech actually backfires because the person says, I was charged up to do something, but the problems are so overwhelming, I just fell right back into the same place again. Okay, what we need to do is engage the listening to understand what is the resistance they're putting up, because that resistance is data. That resistance allows us to understand what we need to consider with respect to our next actions. Okay, so we need to shift out of the kind of adversarial conversation or the polite adversarial conversation and get into this idea of, if we are going to affect people who are pushing back against us, we need to fully understand what that pushback is about. In addition to also empowering people at local levels, the other thing that's become very salient is, whether it's in educating physicians or people at any level going forward, the importance of educating people about systems dynamics is something that we just can't overlook anymore. It's the globalization is so present that the idea that we can do something and it will be completely independent of what the forces that may be going in the other direction, it just doesn't work. And that we need to educate people and have conversations that acknowledge that when we scale up systems, we create qualitatively different opportunities and challenges. If we have a healthcare clinic that's serving 100 people and it goes from 100 to 500 or 1,000, it's not just more, it's qualitatively different. And we need people thinking about these challenges who appreciate that difference as opposed to just adding more of what we're already doing. So I'm offering this as ways for us to continue this conversation and bring into what we're doing is we need to take action in the world with respect to literally dealing with surplus and waste, etc. We also need to acknowledge that that resistance is not something we're just going to turn around, and that we need to embrace that as part of what we're doing to bring about a more sustainable future. So, Polly, I want to turn it over to you now so that you can lead any conversation with our group in the room. Thank you. You're on mute, Polly.
Yes, thank you. Thank you, Reed. Thank you, Andy, for this. Now, I want to say a pep talk. It's based on research, it's based on reality, and it includes all kinds of valuable psychological insights. So I think this is a great combination of things.
Thank you.
And let me go to I have questions myself as well, but I start with a question of one of the audience. Although we are from Singh Shashi, although we are all aware of the choices we make and its consequential outcome, but unfortunately we don't care its outcome in long-term perspective. As a psychologist, how do we educate the people and even ourselves?
Very good. Reed, do you want to say anything about it?
Well, I just want to say I'm glad that I'm not a psychologist and I don't have to answer that. So you can
Okay, so here's what I have to say about that. We have learned over time that that question is actually targeting where the real problem exists. It's not that we don't know, and it's not that we don't care. It's about bringing it into our lives. An example that I give, because so many people relate to it, is a lot of the habits or practices that we're not succeeding at, it rarely has to do with not enough knowledge. So for instance, when I know like middle-aged people who say to me, I'm looking to lose weight and get in shape. And if you say to them, you shouldn't eat a pint of ice cream at 11 o'clock at night and then go to bed while sitting. Nobody ever says, I didn't know that. Oh, thanks, I'll change. They're like, no, I know, but I'm doing things that I know I shouldn't be doing. And I think we need to think more deeply about integrating the practices and actions that support sustainability into our lives so it doesn't require us to go through a whole thought process every single time we're doing it. So we actually need to make systems that work for us as opposed to relying on each person to every day go, I should be doing this instead of that. I know that that's like a very kind of maybe curt or short answer, but I do think that the person who asked this question is putting their finger on a really challenging issue that we've learned over time. It's not about more speeches. It's about finding things that get us to act the way we want.
Yes.
Andy,
Yes, Omri, go ahead, please.
Yeah, can I add to that? This is where I think the field of psychology is absolutely essential to helping us navigate this whole transition into a green society, because we fundamentally have to change everything. We have to change where we get our energy. We have to think about how we travel. We have to think about jobs. We have to think about health. And when we really uh compress it to what is the, like, we have to understand how to communicate better so that people can not only understand but then can feel in some way to become empowered and to think uh across generations. We're so busy in our lives. Some of us have to, pick up kids later today from school and take them to a piano thing or a sports thing. Others of us, we have to go shopping for food, or we have to turn a paper around, or we have to call an ill family member. We have all of these things that make up our daily lives. And then so to actually then plop someone down who is rightfully very busy and saying, I want you to actually now do something that is going to benefit someone you don't know 30 years from now. It's like, come on. Like, this is like, we have, so we have this tension between all the daily actions that we must do and all the long-term goals we know we should do.
Good read.
Yes, thank you so much. I go on, there are many questions, and one to start with you, Reid. Dr. Omary, you indicated that a high percentage of pollution and waste come from healthcare. Can you please specify what that includes?
Yeah, so right off the bat, I consider greenhouse gases as pollution. I consider the elevation in carbon dioxide in the atmosphere as the planetary equivalent of smoking for humans. And we can look at those parts per million, and we can absolutely show that we have a very quick rise, and we're right now at 425 parts per million carbon dioxide in the atmosphere. When we flip that and we start looking at because those numbers or the temperature change, where we've increased 1.5 degrees Celsius since pre-industrial times, that's a pretty meaningless number. We have to instead change those numbers into some meaningful outcome. And that's where human health is so important. And when we look at the dominant cause of global warming, when we look at the dominant cause of climate change, it is fossil fuels. Air pollution writ large causes 8 million premature deaths per year around the world. Air pollution due to fossil fuels, this is according to the British Medical Journal, causes over 5 million premature deaths each year. These are like COVID numbers, and we don't think about them. And when we look at the pollution that happens in healthcare in the United States, and we try to convert that to disability adjusted life years, we're losing over 400,000. So these are numbers, these are, it's just hard to comprehend. So when I think about healthcare, we have this basic tenet of first do no harm. And we have a term in healthcare called iatrogenic injury, iatrogenic harm, which is basically the harm we induce that we didn't mean to. If we give a drug to somebody and it's a side effect, that's iatrogenic. If we do a surgery and then they have a complication, it's iatrogenic. But the emissions, the waste that we burn, where we incinerate our medical waste, is not in the same neighborhoods where physicians live. And so it's mostly, and getting to the point that Andy brought up of systems, healthcare, especially in the US, is such a maze. We get lost in it and we don't even think about, you got to go through this giant maze. And so it gets lost. And so they ask for all of us today is to recognize that when we conduct healthcare without even thinking about it, we're producing waste that also has a harm.
Thank you. Andy, do you have anything to add to it?
No, I
Okay.
mean, we could talk about these things for a really long period of time, but I appreciate how Reid got right at that.
Yes, absolutely. And I have also a question by Dr. Elaine Ohio. How can AI help us with the mindset problem? Maybe through helping us with monitoring in real time and alerting us to pay attention in millions of small steps to shift.
Andy, do you want to take that one?
Okay, I will. First off, hi, Elaine. So thank you for the question. This is timely for me. I have been working with some AI experts recently, and I actually asked this question, and the AI person could not understand the question. And where I'm very curious to see what will happen is, despite the fact that there are all these debates going on with AI right now, will they be conscious in the level of complexity of a human being, whether or not that will ever be matched, we know that it isn't very hard to manipulate us and to affect us. And so it does raise this question of, will AI be able to give us reinforcements and feedback that push us in the direction that we want? Okay. Now, what is the direction what we want? That's going to be what people are fighting about. I think the thing that I'm finding more interesting is if we think of mindsets developmentally, like a 5-year-old has a different way of seeing the world than a 25-year-old. We think of that as normal type of development. We don't think of a 5-year-old as doing something wrong because they don't see things a certain way. We see it as part of them simply developing. If we think of mindsets that way, and that if we like to think that development moves us towards broader and more inclusive ways of seeing the world, not reducing complexity, but embracing complexity to find successful ways to be more inclusive, okay? If we think of it that way, might AI be able to cause reflective exercises or guide us in a way that takes us to, that facilitates development? So that what people who look at this stuff consider to be levels of adult development about which people don't seem to get past. I function well enough in life anymore. I don't even want to go beyond this. Are there ways that the culture can continue to support people in lifting up? And I'm with Elaine. I'm very curious to see if AI is going to be able to do that. The person that I asked couldn't even address the question.
Thank you, Andy. Thank you so much. There are also questions about what actions we can take. For example, by Marian Korkiewski and Carla Orff. Thank you for your presentation. When listening, I was wondering on what level you expect people to act. As patients, healthcare professionals, or scientists? And so I get the arguments, but what type of action do you expect as a result from this webinar? And connect to it, Dr. Simon, you say we need to move away from adversarial and really listen to the sources or reasons for resistance. Can you please say some strategies for doing this.
Dr. Reed, why don't you go take the first half of it and I'll take the second half.
Yes, great. Please go ahead.
This is the such a common question, and it is very much a crux for how we get across this inflection point where nothing seems to change. And I'll address it in two ways. And so one is embedding the concept of the planet's health within the context of human health. So it's the mindset of, so if I am in a healthcare facility and I am on a committee, or I am helping determine the strategy for that facility to ensure that sustainability is part of it. And often it's one of those things, particularly in healthcare, where it's just forgotten. It just hasn't been front and center, and so it doesn't, and it's often considered outside of our lane. So when we're in a committee, when we're presenting to colleagues, to take a moment and explain how whatever actions we're trying to do can affect the planet. And so the more people hear that, the more we start setting up a cascade. The second is to think in terms of our daily choices. And that's where, if we get too bogged down in trying to reduce our own personal carbon footprints, we can drive ourselves crazy. And I don't know how many of you are aware, but the concept of a carbon footprint was really promoted, of all things, by British Petroleum. So British Petroleum hired a PR company back in the 90s and wanted to deflect their contributions to greenhouse gases and shift it onto the individual, which then actually was a brilliant tactic, because we now see some really well-intended climate folks shaming those of us. I'm stuck in an airport right now for, how dare you go on an airplane, or how dare you drive a car that's fossil fuel. So let's convert from the concept of a footprint, which is behind us and what we've done, and instead convert it to a handprint. What can we do? And for each of us, that starts with some reflection and maybe thinking, all right, it's January. In February, I'm gonna go have a conversation with somebody and try to understand what they do and how I might be able to bring my expertise. We're talking about psychology here, how I might be able to bring my expertise to help them be successful and be able to attach this sustainability mindset. So it really starts with listening and trying to share our own knowledge to help others be successful.
So if
Thank
I
you.
can build off of that, we have research in psychology now showing that when people engage in convincing arguments or presentations to affect someone else, they typically do so from the frame they, the speaker, are in. In other words, my values are so inherent, and in many ways I don't see them because it's just the baseline from which I think of things. And when I speak to someone who is disagreeing with me, I use a very logical argument that stems from my initial assumptions, even though that other person does not begin with the same initial assumptions. And the research shows that, as you would expect, and by the way, as a lot of us have encountered, it's really ineffective. And so, as Reed just said, to answer that second part of the question, what seems to be emerging is a very basic but difficult challenge, which is, are we able to listen to people? And are we able to hear what their concern is or what they say the problem is? And the real challenge in doing this is, as somebody's telling me something and I agree with none of what they're saying, it's very difficult for me to listen. And it presents a challenge of like, can I get out of a right-wrong framework in talking to them and get into one that says this person's thoughts are as valuable towards me being successful as what we're trying to do as mine, which does not at all feel true for me emotionally during that conversation. Okay. But if there's one thing I feel somewhat confident about, even beyond the formal research, the informal data that we've all collected, is nobody has to tell me that talking louder or more convincingly or waving my finger at somebody is going to work. It doesn't work. I have overwhelming evidence that it doesn't work. Okay. And so we need to begin to shift that as part of getting into the mindset we've been talking about.
Great, thank you. May I join a question of myself to this? Because I was thinking here in the Netherlands that politicians, they have those goals. They are far away and they are so big. So as you said, Andy, when the problem is too big, you get all kinds of resistance, apathy or resistance doesn't work. And from the other hand, and I'm referring to you, Reed, we see that pesticides used in agriculture, there's quite an evidence that it's causing what is Parkinson disease. So what I wonder is, first, shouldn't have government psychologists and sustainability doctors in their teams to make policies? And second, shouldn't not be the sustainability in the Ministry of Health instead of the Ministry of Environment only? What do you think?
I think we in healthcare, when we look at the professions that are most trusted, so we have healthcare, we have scientists, and we have teachers, and we know there has been a reduction in all of that given the misinformation and disinformation of the last decade. Yet we have much more trust than politicians. And so I think when we look at policies, I think it is a real opportunity to try and work together with policymakers, and we can do this locally. I'm doing it in Nashville. I'm working with one of our state senators on a pollution reduction initiative, and she had sent me the bill that she was going to be submitting, and it had an oversight committee, and it was, environmental specialists, it was waste managers, it was commerce and business folks. And I said, you don't have anyone from healthcare. We have to convert this into a health issue. Everybody cares about health. Like, they may not make those choices and they may decide to eat the pint of Ben and Jerry's before bed. No judgment. I have probably done that myself. Having said that, the more we can embed the concept of health into our other systems. We can embed health into economic security. We can embed health into a sustainable workforce. We can build health into a sustainable supply chain. We all saw when the hurricane that hit the United States back in October, it affected the supply of intravenous fluid for 60% of the entire supply in America. So when we can change these concepts and embed health as opposed to having this be separate and off the side, and I think that was, when we look back, that's what led to the sustained attacks we're having in America right now around diversity, equity, and inclusion. It was perceived as something not essential, as an add-on, and it was maybe promulgated with this sense that it should be separate. But if we can embed this into everything we do, I think we'll be more successful.
Thank you. Can you add to this, Andy?
I mean, the only thing I would add is I think Reid is just getting at this point of, if we're going to be holistic and think in the long term, we need to be very inclusive of what are all the factors that will be involved. So as we're talking about today, I don't have training in medicine, okay? But Reid and I connected on the multifaceted issues that come up when you're trying to solve a complex problem. We need not reduce it to make it simple for us, but it doesn't work. It's complex. It has a very dynamic component to it. And I think what Reid is getting at when we're talking about people that are taking leadership, leaders need to be inclusive with respect to expertise that's brought into solving or addressing the future.
Thank you. I think I'm coming, unfortunately, to the last questions. There are so many. One is Peregrina Gavras saying, one very small step for me is to incorporate into my patient practice agreement this year, is to set aside a paragraph that states, in order to promote efforts towards sustainability, all my sessions are held online. Your monthly statements will be emailed, and I prefer to be paid electronically. If there are other efforts to promote sustainability that I may not be aware of with respect towards your psychological treatment, I encourage you to share them with me. Do you have something to add to this, Andy?
Not me, Reid. I'm gonna, dealing with patients in this way. What do you think?
While I am not in psychology or in psychiatry, my wife is a psychiatrist. So I am married to a psychiatrist, and she spends probably about 2/3 of her practice now doing telehealth. And it is a tremendous opportunity. It benefits patients, and frankly, she enjoys it more. It doesn't so I very much advocate for, when we have the chance to connect with our patients in telehealth, and it works for them and it works for us, let's pursue it, because it definitely has a benefit.
Thank you. The last question, what should we require from our organizations? For example, our national psychological organizations, etc., in following sustainability models? How much should we incorporate training about sustainability in our teaching and research?
So, all right, I'll go first, Reid, then you'll, okay. So Reid and I have been discussing, okay, one of the realms that has to be impacted is education. Okay, so that's definitely one spot. And my response when this comes up is, well, I don't know specifically, but the people that are doing the work in these organizations can take it on themselves and figure out what can be done to support this. And it's about, the sustainability mindset is about bringing this into our conversations, okay? Not just talking about it, but like, what actions can we literally take that have an impact so that we're kind of contributing to moving ourselves towards the future we want, but also we're like representing to people. We're serving as role models of this is how it should be done. Reed?
Yeah, and I would just add that it's in many ways it's easier than we might think, because we all know people in societies who are then trying to plan the next meeting. And often it's the personal relationship. Hey, you're going to be putting on this conference. Can we have a session on sustainability? I'm like, I hadn't thought about that. Well, yeah, and I'm happy to help you assemble a group of speakers. Or can we have the society form a task force to look at our own contributions to the environment and seeing what we might do to reduce that? Or can we perhaps have our society, if they're having small grants, can we just test out a grant mechanism that would explore research in sustainable psychology? It's just an example. These are steps that we've done in many radiology societies, and they all follow the same pattern of essentially some interested individuals raise their hand and say, let's bring this up, and then suddenly it gathers momentum.
Very good. Very good.
This was really amazing. And what you said, we can go on discussing for hours. But maybe we have to organize another. Thank you so much. And I give the floor to Mary.
Thank you so much for an incredibly inspiring discussion. And I hope that we all took many messages from what you've said today, including that one of the biggest barriers to adopting a sustainability mindset is just thinking the problem is too big. I really appreciated that comment at the beginning. So as noted on the screen, the recording from this webinar will be posted on the ICP website, and certificates of attendance will be set. I also wanted to alert you to the next webinar, which will be toward the end of February, on human rights and mental health in Ghana. So thank you. I'm going to stop sharing and put everybody back on the screen so that we can all say thank you very much for joining this webinar today.
Thanks for this opportunity.
Thank you all. Appreciate it.
Bye-bye.
Bye-bye.